CapG Delusion. Imagine waking up and thinking your best friend is an imposter. That's CapG Delusion in a nutshell. Individuals with this disorder believe their loved ones have been replaced by identical-looking frauds, akin to a real-life episode of Invasion of the Body Snatchers. Studies suggest that this condition might be linked to a disconnect between facial recognition and emotional response in the brain. Documented in 1923 by French psychiatrist Joseph CapG syndrome was first observed in a patient known as Madame M, with schizophrenia who believed her husband had been replaced by an imposter. Seeing your mom but feeling nothing. Spooky, right? Cotard's delusion. Ever felt dead inside? Well, folks with Cotard's delusion take it a step further. They believe they're literally dead or missing vital organs. In 2008, this is exactly what Graham Harrison, a British man, believed he had died and was walking around as a corpse. Think of it as the ultimate zombie cosplay, minus the brains. This eerie disorder is often associated with severe depression and schizophrenia. Visualize someone walking around, convinced they're a ghost. It's like a twisted version of Bruce Willis in The Sixth Sense, except they don't know they're the ones who should be haunting. Alien hand syndrome. Ever had your hand betray you? Welcome to alien hand syndrome, where your hand acts on its own, like it's got a mind of its own. It's like having a mischievous sidekick that just won't listen. 1 minute you're tying your shoelaces, the next your hand's throwing your keys across the room. This bizarre condition usually occurs after brain surgery or stroke, making you the reluctant star of your own slapstick comedy. Karen Byrne from the USA experienced this after brain surgery. Her left hand seemed to have a will of its own, leading to incidents like slapping her face. Apotemnophilia. Envision wanting to amputate a healthy limb. That's the disturbing reality for those with apotemnophilia, a condition characterized by an overwhelming desire to become an amputee. It's not about body modification, but rather a deep-seated need that often stems from a body integrity identity disorder. This overpowering urge can be so intense that individuals might go to extreme lengths, including self-harm, to achieve their goal. One example is Chloe Jennings, a British woman who desires to be permanently paralyzed despite being able-bodied. Boanthropy. Think you're a cow? That's Boanthropy in a nutshell. The most famous sufferer of this condition was King Nebuchadnezzar II, who, in the book of Daniel, was driven from men and did eat grass as oxen. Individuals suffering from this rare disorder genuinely believe they are bovine, often acting out their delusion by grazing on grass and mooing. This bizarre condition is thought to be a form of psychosis and may be rooted in deep-seated psychological factors. Picture someone living their life pretending to be livestock. It's like something straight out of a surreal pastoral nightmare. Clinical lycanthropy. Will you ever imagine yourself as a werewolf? Clinical lycanthropy is where myth meets mental illness. Those afflicted believe they can transform into a wolf or other animals, experiencing sensations of metamorphosis and often exhibiting animalistic behaviors. In 2020, a 12-year-old French boy allegedly refused to take part in a school field trip because of the occurrence of a full moon, having bitten other pupils a couple of months earlier. This rare psychiatric syndrome is usually associated with severe mental disorders such as schizophrenia. Picture a modern-day individual convinced they're a creature of the night. It's a haunting blend of folklore and psychological disturbance. Erotomania. Someone is convinced that a prominent figure or celebrity is secretly in love with you. That's erotomania, a delusional disorder where the afflicted person believes that someone, usually of higher social status, is passionately in love with them. Despite clear evidence to the contrary, they cling to this belief, often interpreting minor actions as signs of affection. This condition can lead to obsessive behaviors. For instance, John Hinckley Jr., who attempted to assassinate President Ronald Reagan in 1981, believed actress Jodie Foster would reciprocate his love if he committed a high-profile act. Froli Delusion. So everyone around you is the same person in disguise. Welcome to Froli Delusion. a rare disorder where sufferers believe that different people are actually a single person who changes appearance. This condition is named after the Italian actor Leopoldo Fregoli, famous for his ability to make quick costume changes during his performances. Typically linked to paranoia and schizophrenia, it turns everyday interactions into a bewildering game of hide-and-seek. In Primal Fear, 1996, Richard Gere's character suspects that Edward Norton's character, the defendant, is using different disguises to commit crimes, akin to Froli Delusion. Synesthesia. Okay, a little weird, but kind of fascinating. Start tasting colors or hearing shapes. That's synesthesia, a fascinating condition where stimulation of one sensory pathway leads to automatic involuntary experiences in another. It's like the brain's wiring is slightly askew, blending the senses together in a unique and vivid manner. Synesthetes might see music as swirling colors or perceive numbers with specific tastes. Famous synesthetes include writer Vladimir Nabokov and musician Billy Joel. Nabokov associated colors with letters and sounds, while Joel experiences synesthesia with color and musical keys. Depersonalization disorder. Ever felt like you're watching your life as a movie? That's depersonalization disorder in a nutshell. Individuals with this condition experience a persistent or recurring feeling of being detached from their thoughts, body, or surroundings, as if they're an outside observer. It's like living in a perpetual state of unreality, making it hard to connect with oneself and others. This disconnection can be deeply unsettling and is often linked with anxiety, depression, or trauma. The feeling of dissociation experienced by characters in movies like The Matrix or Inception, where the line between reality and illusion is blurred, serves an example of this disorder. Othell Syndrome. For some, they get consumed by baseless jealousy. Welcome to Othell Syndrome. Named after Shakespeare's tragic character, this delusional jealousy disorder involves an obsessive conviction that one's partner is unfaithful without any real evidence. This can lead to compulsive checking, interrogations, and even surveillance, severely impacting relationships. Often linked with other mental health conditions, such as schizophrenia or obsessive-compulsive disorder, Othell Syndrome can turn love into a relentless search for betrayal. In 2002, American astronaut Lisa Nowak developed Othell Syndrome, obsessing over a colleague, which led to her arrest for attempted kidnapping. Similar themes are explored in Fatal Attraction, 1987, where Glenn Close's character becomes obsessively possessive. Diogenes Syndrome. Have you come across someone living in extreme squalor, yet seemingly indifferent to their surroundings? They might have Diogenes Syndrome. This behavioral disorder is characterized by severe self-neglect, social withdrawal, hoarding, and a lack of shame. Often affecting the elderly, it can go unnoticed until conditions become dangerously unhygienic. Named after the ancient Greek philosopher Diogenes, who advocated a life of minimalism, the syndrome presents a stark contrast, posing significant challenges for social and healthcare services. Body integrity identity disorder. The feeling of a body part not belonging to you indicates body integrity identity disorder, BIID, where individuals intensely desire to amputate a healthy organ. This condition involves a profound psychological mismatch between one's physical body and internal sense of self. In 2006, Jewel Shuping, an American woman, blinded herself with drain cleaner due to BIID, illustrating the extreme lengths some may go to align their body with their self-perception. People with BIID often fixate on a specific organ as foreign or intrusive, seeking amputation as a means to achieve a sense of wholeness and alignment with their body image. Clu Booy Syndrome. Picture losing all fear, eating nonstop, or exhibiting inappropriate sexual behaviors. Clu Booy Syndrome results from extensive damage to the temporal lobes in the brain. Symptoms include hyperorality, compulsion to examine objects by mouth, hyperphagia, excessive eating, hypersexuality, and visual agnosia, inability to recognize familiar objects or faces, Originally identified in monkeys, this rare condition profoundly affects behavior and emotional responses, underscoring the critical role of the temporal lobes in regulating complex human behaviors. Folie à deux. Ever wondered if madness can be shared? The cult classic film Shutter Island, 2010, explores exactly that. Folie à deux, or shared psychotic disorder, occurs when two or more individuals in close relationships develop delusional beliefs simultaneously. Typically, one person, the primary or inducer, harbors a genuine psychotic disorder and influences others to adopt their delusions. This rare psychiatric condition highlights the powerful dynamics of close relationships and the profound impact one individual's mental state can have on another's psyche. Geschwind syndrome. Those developing obsessive interests in religion or philosophy after temporal lobe damage experience Geschwind syndrome, a rare condition associated with changes in behavior and personality due to temporal lobe epilepsy. Symptoms include hypergraphia, compulsive writing, hyperreligiosity, intense philosophical preoccupations, and altered sexual behavior. Ellen Terry, the late 19th century English actress, exemplified these traits. Named after American neurologist Norman Geschwind, this syndrome highlights the intricate links between brain structure and function, revealing how epilepsy can dramatically shape an individual's identity and pursuits. Alice in Wonderland Syndrome. Witness your body or surroundings distorted. That's Alice in Wonderland Syndrome. Named after Lewis Carroll's famous tale, this neurological condition alters perception, making objects appear larger, smaller, closer, or farther away than they are. Sufferers might feel their body parts are changing size, or that time is moving differently. Often linked with migraines, infections, or epilepsy, this syndrome offers a disorienting yet fascinating peek into the brain's complex processing of sensory information. The distorted perceptions evoke surreal imagery akin to Lewis Carroll's novel or modern films like Inception, 2010, or Doctor Strange, 2016. Ebom syndrome. The delusion of being infested with imaginary parasites is a common trope in horror movies, often used to heighten dread. That's Ebom syndrome, also known as delusional parasitosis, an ordeal more than 100,000 Americans reportedly face. Individuals with this condition believe they are plagued by parasites, leading to severe itching, scratching, and even self-inflicted injuries in an attempt to remove the imaginary invaders. This disorder can be profoundly distressing, often resistant to medical reassurance and intervention, and often requires psychiatric treatment to alleviate the deeply ingrained delusional beliefs. Paris syndrome. Watched Midnight in Paris and felt disillusioned? You might have experienced what visitors to Paris feel: the Paris syndrome. This transient psychological disorder affects tourists experiencing severe culture shock in the French capital. Symptoms include acute delusions, hallucinations, anxiety, and physical ailments like dizziness and sweating. The stark contrast between the idealized image of Paris and its reality can trigger this distressing reaction, particularly among visitors with high expectations and little previous travel experience. Reduplicative Paramnesia. Ever been convinced that a familiar place exists in two locations simultaneously? A 78-year-old male, cited in the National Library of Medicine, had hallucinations that he was not at home and that his home was in a different country. He was experiencing reduplicative paramnesia, a rare delusional disorder where individuals believe a place has been duplicated or relocated. Commonly seen in patients with brain injuries or neurodegenerative diseases, this condition highlights the brain's role in spatial recognition and memory. The belief in the coexistence of two identical places reflects a profound disconnection from reality, posing unique challenges for diagnosis and treatment. Mirrored self misidentification. Ever looked in the mirror and not recognized yourself? That's mirrored self misidentification, explored in the classic Star Trek episode Mirror, Mirror, 1967, where the crew encounters their evil counterparts from a parallel universe. This delusional belief causes individuals to think their reflection is someone else, often stemming from neurological conditions like dementia or brain injury, disrupting self-recognition. Sufferers may perceive their reflection as a stranger, mimicking their movements, leading to confusion and distress. This condition underscores the brain's complex mechanisms in visual perception, challenging its ability to distinguish self from others. Stendal Syndrome. Overwhelmed by art, that's Stendal Syndrome in a summary. Named after the French author Stendal, who described feeling dizzy and anxious while viewing Florentine art, this psychosomatic disorder manifests as rapid heartbeat, vertigo, and even hallucinations when exposed to beautiful art or historical settings. While rare, it underscores the profound impact that excessive aesthetic appreciation can have on an individual's psyche, turning a cultural experience into an intense emotional roller coaster. Jumping Frenchmen of Maine. A reaction to sudden stimuli with exaggerated movements and uncontrollable shouting. That's the essence of jumping Frenchmen of Maine, a rare neurological disorder first documented among French-Canadian lumberjacks in the 19th century. Those affected exhibit an extreme startle reflex, often leading to involuntary actions. Thought to have genetic and environmental triggers, this condition offers a fascinating glimpse into how human bodies can respond in highly exaggerated ways to unexpected events, blending neurology with folklore. Autophagia. Ever felt compelled to chew on your own body? That's autophagia, a condition where individuals have the urge to bite, chew, or eat parts of their own body. This behavior, depicted in the film 13, 2003, embodies self-destructive acts as a coping mechanism. Often linked to severe psychiatric disorders, such as borderline personality disorder, autophagia serves as a drastic response to extreme stress or emotional pain. Pika. A British woman named Leslie Cusack began consuming Vaseline, cough syrup, and even emulsion paint, showcasing Pika, a disorder marked by cravings for non-nutritive substances like dirt, chalk, or hair. Common among children and pregnant women, Pika poses serious health risks such as gastrointestinal blockages or poisoning. Its causes, linked to nutritional deficiencies, mental health issues, and cultural factors, are not fully understood. Thanks for joining us on this eerie journey through the mind's most bizarre delusions. From thinking you're dead to believing everyone around you is a doppelganger, the human brain never ceases to amaze and terrify. Stay curious, stay skeptical, and remember, sometimes the strangest stories are the truest ones.